Hello, everybody. Dr. K back with you for contact tracer training. And we're now in Unit 2, Part 1. And let's take a look at the SARS-CoV-2 virus uh, in particular. This is the coronavirus that we're experiencing now, COVID-19. Coronaviruses are a large group of viruses, and as you can see the diagram, of course, this is multiplied many times because you can't see it without the benefit of a microscope. Corona actually means crown, and that's how this virus got its name. Uh, and these coronaviruses, they may infect a large range of animals and birds, and sometimes they can cause a mild respiratory illness in people. Now, this SARS-CoV-2, this is a new coronavirus. This originated in bats, and some of these coronaviruses can jump from species to species or can be transmitted between people. This is the third coronavirus that we've experienced since 2002. We recall the SARS, the severe acute respiratory syndrome that emerged in Guangdong, China in 2002. And then we had MERS, Middle Eastern Respiratory Syndrome, came out of the Middle East in 2012. And this particular new coronavirus is the SARS-CoV-2, what we refer to as COVID-19, which became known in Wuhan, China in 2019. You'll recall the lockdown that occurred there during last fall and winter. So what happens to people after they get infected with SARS? I mean, not everybody who gets infected gets sick. Many people get it, but are asymptomatic, like they don't even know they've had it. But if somebody gets sick, what are the signs and the symptoms? How long does it last? And how long can they be infectious? And how do people shed their virus? Well, one of the things that we do to see whether or not people have symptoms, we take their temperature. That's something that many buildings have been doing to screen people. It's not enough, but that's one of the measures. People with perhaps some breathing issues. We can notice people having perhaps some breathing issues. Some of the symptoms they might experience or express: tiredness, fatigue, more than usual, some nausea. One sign that is telling is a loss of taste or a loss of smell, muscle ache, and fever is both a sign and a symptom. So, again, some people can be asymptomatic, have no symptoms. Some people have very mild symptoms, and some people can get so sick that they require ventilators, and ultimately, many people could die, and to date, many people have died in our country and around the world. So, some common signs and symptoms are fever, tiredness, chills, muscle pain, a dry cough, a loss of taste or smell, difficulty breathing, headache, sore throat. These are things that should cause you to stay home during this pandemic. And many of the symptoms are non-specific because, fever, cough, myalgia, muscle pain. Other diseases have that. Other illnesses have that. But some are more specific to COVID. Like I mentioned, the loss of taste or smell. That's not very common at all with other infections. So that really is a telling sign when people tell you, "Oh, all of a sudden I can't taste my food or I can't smell things." And so there are indications if the disease is getting worse, such as it's getting harder to breathe, the fever is increasing. This means the disease is becoming more severe, more is progressing. We need to, as contact tracers, as caregivers, we need to be able to recognize the the signs when it could be an emergency and we need to seek hospitalization. Blue lips, a blue face means difficulty with oxygenation, and that's a real warning sign. It, increased rate of breathing and shortness of breath. When they complain of chest pain, when someone's sick of complains of that. Another severe sign would be like disorientation or confusion, or really just difficulty waking up beyond normally, beyond that normal feeling. Look at a healthy lung. Look at a lung with somebody with severe COVID. Healthy lung, somebody with severe COVID. Obviously, you can see the impact on the breathing there. Again, the incubation period is when somebody is infected until they develop symptoms. Sometimes within 5 days, sometimes, maybe half of them maybe 5% within 2 days, maybe 50% within 5 days. Sometimes it takes as long as 14 days before we notice symptoms. But by 14 days, we pretty much know that if they're going to get it, they've gotten it or not. Of course, this 14-day period is significant because that has implications for isolation and quarantine. So, this infectious period is the time when people can transmit the virus to other people, and the period starts again 2 days prior to the start of prior to they getting symptoms, and it's going to go until the person that you had contact with or that person has no more symptoms. And there are some people that have had symptoms or have been hospitalized for months during this pandemic. Although we are getting better at helping people once they get to the hospital, we still need to be very conscious of preventing community spread and knowledgeable about the timelines involved with the symptoms and signs of this coronavirus. I'm Dr. K, and I will be back with you again for Unit 2, Part 2. Bye.